Good morning, everybody. Welcome to the second quarter meeting of the Palmetto Vision Alliance for 2024. It's hard to believe that May is already upon us, but we're grateful for everybody who's taking time to be with us in person this morning, or if you're watching this recording later. We're very excited to welcome two very special guests to talk with us about a perennial conversation starter in this group, and that is how can we better build trust in, build credibility in, and have a meaningful impact in the rural communities around our state that many, if not all of us, are working more intentionally to serve and to come alongside. And so with us today, we have Paola Gutierrez, who's the Director of External Engagement at the South Carolina Office of Rural Health, and her colleague, Jessica Seel, who is the Director of Behavioral Health Initiatives and Workforce Development. They're going to be sharing a presentation with us this morning on reaching rural communities. And I'm going to go ahead and put that presentation up on the screen here. We will have time throughout the presentation. If you'd like to pause and ask questions, you can also submit questions through the chat, and I'll watch for those and we'll address some of those at the end as well. And you can also reach out to us for any follow-up. We'll provide Paula and Jessica's information in the follow-up email from today's meeting, along with the recording and the slides. So Paula and Jessica, thank you all so much for being here, and we'll turn it over to you. We look forward to hearing from you.
All right. Well, thank you for the invitation. It's always a gift to be able to share what we do at the office. It's definitely, it looks very different than what it was 10 years ago. And Jessica and I, we actually started, if you'll go to the next slide, Jessica and I started around the same time. What are we, a month apart?
Exactly.
And so we had the same opportunities and challenges, and we've grown both our programs because they're very unique. They're new, and we started from scratch. And so you'll hear more from Jessica. Those are our titles and our little pictures. Next slide. And so this is what really drives us, because we have such a huge percentage of residents who we have a close relationship with through their local leaders, and they go from grassroots to government, and we pride ourselves in having that trust with the community. Next slide. And these are brand new. This is from a presentation earlier this week. So we wanted to kind of give you an idea of what our office looks like. So we have two offices. One is in Lexington, where we are today right now. And then on the bottom picture, we have our Orangeburg office, Family Solutions, where we house a resource center. And that is very new and very successful as well. You can see we have a lot of different funding streams. You can see our annual budget and the sources we've got. And I think that what is most important for you to think about is the bottom bullet, and it's the 1,900 encounters we have in all 46 counties. Some counties have more encounters than other, but as you probably know, as Lions Services, Vision Services, and also Palmetto, I'm so used to Daniel and Lion Vision Services, you have your challenges reaching out to some communities within the state, and we have similar, pressure points as well. But compared to many agencies, we are the ones that are sought out to help us buffer and to connect the community and the different programs because we are a trusted partner. Next slide. And, our objectives here, one of the newer ones, we're really hammering down on social determinants of health. We did touch upon those before Jessica and I started at the office, but after the Rural Health Action Plan, which is why I was hired, we really started to broaden our scope and think about what makes a person healthy. And it's a lot more than their access to a brick and mortar clinic or hospital. It's being able to have a job, being able to see, having great mental health and the resources to maintain a stable mental health. Next slide. So I just mentioned the Rural Health Action Plan, and it's kind of 15 recommendations, health, housing, education, employment sectors. It's all been very rewarding. And if you'll go to the next slide. And then after the Rural Health Action Plan, we started thinking about Rural Forward, because my role with the Rural Health Action Plan was to create awareness around this document and the different actions which would be necessary to move the needle in rural areas to improve these different sectors. And so we definitely want to celebrate the unique character of rural communities while enhancing the resources so that they can be self-sustainable. You can go to the next slide. And these are all of our touch points within South Carolina. And you can see on the left side the different programs that we have. And all those are the 1900 technical assistance encounters that we had in a year. And so that's those are the programs that we're diving into. And as you can see, there's some counties that have a lot more dots. And then we've got Colleton County that just has 2, for instance. It's not a lack of desire. It's just a lot of different moving factors of what resources are there, who's reaching out to us, because we definitely are not an agency that is prescriptive. We want to make sure that it's a participatory and give and take, relationship, or give and take doesn't sound right, but it's reciprocal. Thank you. A relationship, because we don't want, I think I'll say for myself, not necessarily SCORE, but in my whole professional experience, I've seen many times when higher education wants to do some research and they go into a rural community and they tease them a little bit. They offer them some gift cards and then they come out. That's not what we're doing. And they also think based on data that that's what a community needs. And the data may tell a story, but the voices of the actual residents have another story. And so that's what we rely on, backed by the data. Next slide.
Yeah, Paula, if I could just linger
Course.
for a second on there. I'm glad you pointed that out. When I saw Colleton County and really, frankly, Aiken County too, with only 2 program dots, that really surprised me. Knowing, if you were looking at the typical definition of rural that most of us think of, I would certainly say that the vast majority of the geography in Colleton and Aiken counties would fit into that category. But your way of framing it was very helpful for me, at least in terms of thinking about why an area, just because it might meet a basic stereotypical definition of rural, it may not be that they want or need all of the programs or services that are available, to your point about the culture. So are there anything, is there anything in particular in your view that has stood out, that has helped to move the needle on getting more awareness in those areas, for individuals to understand what resources are available to them and help them start connecting the dots, pardon the pun, since that's what's the the dots are up here. Have you seen anything that has moved the needle in some of those other areas where there are lots of program overlaps? What got you from a starting point to having more engagement points in some of those communities where you're doing more?
I would have to say it's the partnership with the different organizations. Before, and I think in a previous slide, there was something mentioned about silos, and that we're working on avoiding working in silos and encouraging partners to join either a coalition or some sort of body that helps to coordinate efforts, because when the efforts are not coordinated, we run into a lot of competition for grants or just money in general. We run into the community getting confused. So rural has become very popular. And just in fact, yesterday I found out of some rural entity And I thought, where did they come from? And it's good. And it's even better that they reached out to me, because that way they're not working on their own saying, oh, we're going to do our own thing and just go with it. And so to my point is, it creates confusion in the community, because you'll have an entity that has a similar name, something related to rural, and a lot of times the residents see these organizations as almost the same thing, and they'll say, didn't you come last week or 2 weeks ago? And so that confusion creates distrust, and then the communities can be resistant to when you come in for an assessment or a partner introduces you that's internal to the community, and it can cause a slew of barriers. What else can I think of in terms of moving the needle?
I would say that one thing to remember too is Paula and I have both been here 6 years. And like she said earlier, I'm not sure if we just lost you guys. Something happened with the laptop.
Oh, good. Nope.
But it takes time. It's not something where you come into a community and everything is immediate. Now, some are because we've had a presence there, but it can literally take, 1, 2, 3 years to build trust to where folks start to see you as a needed partner and invite you into the community. So I think that's important to understand is you need to be patient with rural communities.
Mm-hmm.
Yeah.
And I would say that our efforts in communications, and it kind of goes along with, getting partners together, but telling our story as much as possible. Daniel, we're connected on LinkedIn. I'm sure you've seen all the posts that I have each week or every day, because not enough people know about what we're doing. And it has been very helpful to get out there, because I do get folks reaching out saying, hey, tell me a little bit more about this that you posted, whether it's reposting a colleague's endeavors and project successes or requests, or my own, or even a community's events. That is very helpful. So it would be the connectivity to folks, and that cohesion, and this communications piece.
Awesome. Thank you both for that. That's really helpful context and very helpful practical things to think about for implementation.
You're welcome. You can jump over there we go. So I'm going to dive in a little bit more specific to what I do. So as the Director of External Engagement, I've really specialized in cross-sector collaboration. But nowadays, I think everyone has, to be honest, now that I think about it. And that's another thing that's been very helpful, going back to your previous question. So in addition to collaboration, is making sure that the right people are at the table, because I think a mistake has been made in the past of assuming that one entity, like let's say behavioral health, that you only bring in those specific in behavioral health. But in fact, there's a lot of different components: housing, transportation, workforce. And so I think that is also true to your previous question. Now, for what I do, I manage, these bullets, which are the Digital Economy Ecosystems project. And so we have 6 sites, and those are Barnwell, Williamsburg, Orangeburg, Greenwood, Newberry, and now Oconee. Oconee is finalizing their roadmap. And so this consists of leadership development, participatory planning and budgeting, and then it yields strategies for rural communities to have a digital economy ecosystem. What is that? A digital economy ecosystem is an area that is self-sufficient when it comes to remote jobs, innovative work, anything that you can do without leaving your area. And it could be coding, resource sharing, classes. There's a lot of different models, and it looks a little bit different in each of the 6 counties. The 23rd will be Greenwood's first class. So as you may know, Greenwood has a strong textile history, And their innovation lab is called Spin Lab, like spinning for the textile, like one of the machines are doing the spinning, and then Spin Lab. And so they're having their first class, and that is a huge success, for Greenwood. And the other sites, they have innovation centers. Soon we'll be featuring a video that we've created. We still have a few details to iron out to make sure it's perfect. Well, nothing's perfect, but that it's the best it can be. But it is very compelling, and I'll share it with Daniel, and you can see this video that will tell a better story when it comes to individuals in the digital economy ecosystem. And the Digital Equity Collaboratives is kind of the bigger umbrella where digital economy ecosystems is housed, and that is just finding out who's who in South Carolina when it comes to digital equity, to making sure that everyone, despite of their location, their age, and their education level, know what they can do with all this new broadband. You all know that broadband has drastically increased and improved in our state. And if you haven't, it is improving. And the Office of Regulatory Staff and a lot of grants that have been created for the internet service providers to expand the network has been very successful. And so it's like having electricity but no light bulbs, right? So what good is the electricity if you don't have the light bulbs or your stuff to, that gets powered? And so this is no different. And so the digital economy ecosystem and the Digital Equity Collaborative, it aims to fix that projected problem. Right now, it doesn't seem like a problem, but if folks don't get the proper training and get up to speed with the resources in digital equity or digital resources, then they're going to miss out here in South Carolina. And there's going to be folks coming from out of state getting those jobs when we have the talent here. Now, food systems, that is something that we're involved in with different colleagues of mine. And then with me, we're looking at, how we can improve rural grocery stores and have a toolkit. And that's still in the works, but that's something that I'm active in. And then rural outcomes that Daniel, I think that's how we met. You started and you got to know us, especially during COVID. And so that is kind of similar to the Digital Equity Collaborative, is finding the who's who in rural. And we welcome all partners who want to know what rural resources are out there, how they can better serve rural. And the culture is to come with transparency, the transparency to say, I have money and resources, write me, apply for this grant or whatever it may be. And also having the transparency of saying, I work for this organization and this is not going well, please help me. And it's been very fruitful. We've had a lot of touch points and connections and organizations helping each other out, going back to the point of collaboration is key. And when folks get together, they do a lot more than trying to figure it out by themselves. Next slide. And that's Jessica. So we can wait to the end or whatever model you'd like, but I'll have Jessica take it from here.
Okay. So I'm going to switch gears a little bit because Paula's program and my program are vastly different. Mine is focused on behavioral health, which is very near and dear to my heart. This program really got started probably, I would say, in 2018 here at our office when I began my job here. I took over this role in 2020, right in the middle of COVID. So guess what happened? Behavioral health became a major topic. We really unveiled some of the disparities, specifically in our state, actually across the country, and it became a priority area for most organizations. And what I've found about behavioral health is it touches everyone in some way, right? I don't know about folks on here. I see someone from ABLE. I work with ABLE a lot. It's brought new partners, really realizing that there is not a group of folks that are not either experiencing a behavioral health challenge themselves, have a family member, friend, neighbor, So I feel very comfortable talking about this, and hopefully you guys will see some of the work that we're doing. Really, a lot of it is about community education. There's a lot of stigma around behavioral health, mental health, but really more around substance issues and suicide. And so I've taken this challenge here at the office and decided that what it really takes is getting people to talk, educating folks, working directly with the communities, which is something I absolutely love doing, to identify their needs and to work with them to make their community a better place for all, regardless of your challenge or where you live. So this is just a snapshot of some of our work. I support interagency collaboration. Paula mentioned siloed work. I think you probably all know what that's about. But one thing that, we deal with here is getting folks to talk and make sure that we don't have some of our citizens falling through the cracks, because there are a lot of different programs. Either people don't know about them or the programs are not talking, and people suffer when that happens. So that's something that we've been doing. I'm doing that specifically right now in Pickens County, and it's been very fruitful, like Paula said, as well as interesting, and it's been a learning experience for me. Behavioral Health Coalition support and facilitation, same thing. I'll be in Newberry County this afternoon. That's actually where I live. Really helping get coalitions to look at their behavioral health needs. It's a challenge because when you say that, sometimes folks really are kind of back away and, well, we don't really have those here, or, that's something that we don't really have the capacity to take on. And so it's my job to kind of help facilitate that and move folks forward. Recovery friendly workplaces, when we're talking about economy and the health and wealth of our state, it's really important that we keep folks employed. It's also important for folks that are in long-term recovery from drug and alcohol use or mental health challenges to become employed and be in a situation where they feel comfortable with their employer, and that they are provided resources that they need. Behavioral health workforce, huge challenge in our state. It is not something that folks, come straight out of school and say, I think I want to be a social worker, unless you've had experience. That's actually my education. But we want to get more folks interested in working with people and seeing the rewards of being a provider and helping folks get through a difficult time in their life. We do community conversations really to address stigma around substance use disorder. And something that I'm really excited about, and I can't wait to tell you guys about, is Walk in Our Shoes, Empathy in Action, which is a behavioral health simulation. I'm going to go into that more in depth in the next slide. Thank you. So this was built by our office, with our office and stakeholders across the state to provide an opportunity. And I'm not sure how many of you guys have ever done a simulation, a poverty simulation, where you really take on a persona and get that authentic experience as what someone's feeling when they have to choose between purchasing a medication or having their electricity on, or buying food. And I went through one, and it was powerful for me. And so I decided a couple years ago that we were going to build one around behavioral health. I wanted to make it specific to South Carolina, so I convened folks across the state that either work with individuals with behavioral health needs, or work in policy around that, or folks with lived experience. And I wanted them to tell their stories, what they had seen. So through that, we developed 35 households that are based on actual things that have happened in South Carolina. And we really ran the gamut of behavioral health issues, some poverty, some folks with disabilities, all different issues that individuals face based on the population of South Carolina. We also have volunteers that play service providers. So not only do you experience what someone's going on behind the doors of their home, but you also experience what it feels like to be them and to interact with different services within South Carolina, whether it be DSS, the schools, getting mental health support or accessing medication assisted treatment for an opioid disorder. And there's an MC that facilitates this. It took 1.5 years to build this, but we are really starting to get a lot of momentum. I just did our first one with DHEC. We're going to be doing one up in Oconee County. We've been written into a grant to do it for the medical school students because we know that providers need to understand what folks are dealing with beyond that initial encounter, just a deeper dive into folks' life. So we're hoping that this can address stigma, but also address some policies in our state that probably are well-intended, but aren't working. Next slide, please.
Jessica, on this one, similar to the poverty simulation that you mentioned, is this a program that if any members of the Palmetto Vision Alliance are hearing this and say, oh, I'd like to bring that to our organization or to our community, is that something, could they contact you to learn more about how to do that?
Absolutely. What we do is my partner here with behavioral health will get on a call with whoever's interested, kind of talk about some of the details, what we would need, and we will go through the planning process. And then, yes, we MC it, we have all the supplies, and it's pretty much turnkey. So absolutely.
Awesome. I can imagine there might be some interest there. Thank you.
Yes, please. So here's some photos. This was our first simulation. Wow, talk about a day where nerves got the best of me. This was a tough one. You work on something for so long and you roll it out, and I was so pleasantly surprised that the impact was palpable in the room. We had about 65 participants. We had our steering committee serve as service providers. And we got some great feedback on this. Some of the things that we've heard is it really made me feel differently about the folks that I'm serving. It really made me reflect on some experiences I had in my own life. It gave a greater view of, again, those policies that are in place that are well intended, but really just when you see them in action aren't working. I think we give folks some takeaways from this, and it was pretty amazing. There were some tears that day. We actually have someone on site that's a provider, because believe it or not, maybe you do, but talking about these kind of things can really, bring some emotion. And we want to make sure that we're there when folks, have those experiences. We also want to make sure that we are ready to connect with them with any resources that they need. Next slide, please. This is a really cool, I don't know if any of you guys are in the upstate, but if you are, reach out to me. We want you. We have a great initiative. This is, again, kind of merging what Paula and I has talked about, is merging that economic development side with public health. Specifically behavioral health or other chronic diseases, they affect our state. They affect the way that folks are employed. They affect the way that businesses run. They affect, the way that schools are able to operate. I mean, it really is a ripple effect when we don't address behavioral health needs, but public health needs overall. So DHEC did a data walk in their 11 county upstate region, and every single county, with the exception of 1 or 2 counties, had behavioral health issues as their #1 priority and #1 issue. And the other 2 had it as #2. So that was telling. And what they did is they were partnering with 10 at the Top, and I'm not sure if you guys are familiar with them, but they're an economic development organization, a business organization, like in the top 10 counties in the upstate. And they had some of their members attend, and we all talk about public health issues and data around it, and we understand that. But boy, when you get folks in a room that are in a different world, it was shocking. And not only was it shocking, it was a call to action. What can we do to work together to address this, because it's going to hurt our county. And so this is where we had the birth of Resilient Upstate, which we started convening a year ago of a variety of behavioral health stakeholders across the state to understand what their experiences were, and where they thought the priorities were to address these issues. And these were the 4 priorities that came out, which are stigma, building a better and stronger behavioral health workforce pipeline, working with businesses to link them to behavioral health resources because they have folks working there. They don't know how to address these needs. It has grown exponentially since COVID. They're not prepared to do that. You know, the days of just providing an EAP, it's not enough anymore. So we want to support them and connect them in with those resources. And then behavioral health systems, getting our systems, like I said earlier, to talk and provide a better care continuum. If you're in crisis and you have to interact with 4 different organizations to get your care, that's not good. That's where you're going to lose people, and that's when death or other things occur. So we're really working specifically in these counties to build better linkages between the different organizations that are serving folks. Just that last week, I presented on this at a big opioid conference. It was the governor's summit. And I had folks from across the state saying, how can we build something like this in our region? Because it's just in the upstate. So we're really working on with DHEC on how can we make this applicable to the other regions of South Carolina and help them build this really awesome link of different folks just wanting to serve citizens with behavioral health needs. Next slide, please.
Do organizations have to be physically located in one of those 10 counties, or if they're serving and working in those counties, could they participate?
Absolutely. We're not in those counties specifically. And I'm leading it. So we have folks, Abel is involved. I'm sorry to keep calling on you, Dory, but I've seen Dory at many different events. So you know, I'm a fan. But they're there. Anybody that serves.
We love working with you. No worries.
Thank you. Thank you. And so, no, we just want to get good people that want to do good work and want to break those silos. At every meeting, I say, let's remove our logos and our egos and let's just work together as South Carolinians. And that
logos and
that gets a
egos.
giggle, but
I
it
might borrow
works.
that from you.
Yeah, no, I borrowed it from somebody. I didn't make that up. But it works. So, you know, that's what it's all about, right? Next slide, please. This is, you know, I talked a little bit about employment, and I know, you know, one thing that I don't think I need to tell you guys, anybody, but, you know, here I am talking specifically about behavioral health, but strong employment can change lives. Not being employed can also change your life. And when someone has experienced, you know, an addiction or a mental health challenge and has gone through recovery and is trying to rebuild their life, it's very challenging when you go out and try to seek employment and you're turned away. Whether it be that checkbox on your application, that living in a small rural community and everybody knows your business, knows that you went through this, knows that you were in treatment for, you know, however many months, and it kind of keeps you away from employment. And so how can you expect someone to rebuild their life and be a citizen that can provide to our state or their families without an equal opportunity for employment? And not just employment that you would expect, but real employment, meaning if I have a dream to go back to school, or I have a dream to become an electrician or whatever it is, you should have that same opportunity as someone that didn't go through those challenges. So we're trying to remove those barriers and really build businesses that recognize the need for this type of policy, that recognize that people should have an opportunity to rebuild their life, that recognize that they've come through recovery and they're pretty strong and sometimes are your best employees. We also want to help folks get to a level where they feel comfortable applying for jobs. They feel comfortable for going to go back to school, or to go into an internship, or an apprenticeship. And so this is a project funded by the Appalachian Regional Commission, which is, they have 7 counties in the upstate of South Carolina. And we are looking at working, or are working, in Cherokee, Pickens, and Union counties. We're engaging employers to create what they call recovery-friendly workplaces, which is something that's going on very strong in other parts of our country. And there are great outcomes from this project. So we'll be building opportunities to engage with employers, educate them about addiction, get to know folks that are in recovery and what that looks like, and debunk some of those myths and stigma. And really work to develop a training curriculum for businesses on how to become a recovery-friendly workplace and support them through that process. And so this is a project I'm very passionate about. Even when I was in school for social work, I had a friend that had a nonviolent felony on his record at 19 years old. At 55, he was still struggling to find employment with 2 degrees from the University of South Carolina. So I've seen it in action, and so I've kept that in my heart. And so this is just a project that's really near and dear to what I want to accomplish, is helping folks, you know, reach their goals and their dreams. Next slide, please. And then finally, we talked a little bit about our community conversations. We honestly, guys, sometimes you just have to get people in a room and talk. Understand, meet them where they are, understand their thoughts, belief, bias, and just sit around a table and discuss a little bit, provide a little bit of education and understand where they're coming from. And that's what we've done here. We've worked in 11 counties so far. We've reached 100 community partners. We've hosted these with a fantastic facilitator from the University of Rochester in Rochester, New York, who uses videos of folks that have experienced substance use disorder and opioid use disorder and have come out on the other side and have really rebuilt their life. And it takes that, what we talk about, it takes that data point and actually puts a human being's face and story to it. So this is very impactful as well. Next slide. And again, behavioral health workforce, we're really advocating for stronger loan repayment and incentive programs for folks to go into these training programs, to get individuals that look like other individuals they're serving into these training programs, to advocate for a higher pay scale, and to be able to get folks from rural areas working in those rural areas and serving their neighbors. And so workforce is really the cornerstone of our office. So we do all workforce, but I'm specifically in behavioral health workforce. And so that's all I have, guys. So I think, are open to questions or comments.
Absolutely. Please feel free, if you've got any questions or comments, just take yourself off of mute and jump right in. So we've got a comment here from Abby. One of the big challenges we face with donation is education in rural areas. The urban legends about donation persists, leading to suspicion about donation. We would love to work with you to help reach those communities.
I think that's very similar to what I experienced with behavioral health, a lot of, urban legends and misinformation. And I think the same thing, getting in there. One thing I would suggest is, if you target some specific areas that you're interested in, rural areas that you're interested in working in, work with us to identify if there's a community coalition that exists. I bet there is. Not too many, we don't work with or know someone that's a part of one. Get engaged, show up, participate in those meetings, continue to show up, offer education there, and that's how you're going to get in and get some of that offer to present. And those are usually the movers and shakers that can get that information out to the right folks. Any comment on that?
Do you have like a master list of where those community coalitions are? I mean, I know we're aware of a number of them around the state, but is there any kind of central directory of all that are in operation?
I don't think so. I think now, are you guys engaged at all with the Access Health networks?
I think some of our members might be. Lions Vision Services is not currently with Access Health right now, but we would certainly like to have those conversations.
So if you go on to the South Carolina Hospital Association website, they have a list of all the Access Health networks. I don't know, neither of us know of a repository for all the behavioral health or the community coalitions. Certainly, like I said, reach out to us. And if you say, hey, I'm interested in doing something in Union County, we will talk to our coworkers, and like you guys saw the dot map, let's see what we have going on in that area and see who we can connect you in with.
Awesome. Thank you.
Yeah.
And I'll add that another opportunity, and I can't believe I forgot to add this to the slides. We have an annual conference,
Yes.
and November 19th through 21st, we will be in Greenville. Why Greenville? Greenville is not rural. I'll argue that once it was rural. I was born and raised there. But we're a traveling conference, and we want to give the opportunity to both rural and metro areas to understand what our work is, and to give them the opportunity to learn from the different sessions that we have, and the, what are they called? Not sponsors, the
Vendors.
vendors. Thank you.
Vendors. Yeah.
The vendors who are there. It really is a highly engaging conference, because we are in social determinants of health. There are a lot of different there's something for everyone at this conference. We have fun and everything. What will you share the
Will you
information
share
about the
information?
conference?
Yep. We will.
It's also on our website. So if you'll see the website on this slide.
I'm pointing like you can see. Score.net, SCORH.net.
And I think one of the first things that pops up could be the conference information. Registration is not up, but you know what is up and ready to go. If you're interested in presenting, that is open right now until May 31st.
Walton options.
Edgefield yeah. Okay.
Awesome. Thank you, Cindy. Sounds like there's a couple of regional coalitions there in the Edgefield area.
Mm-hmm.
Definitely. Edgefield has Orangeburg, right off the top of my head, Orangeburg, Edgefield, Oconee, Greenwood has a fantastic.
We know Rick. Yeah, Rick Berry, we know him. And also at the very bottom, you'll see our rural focused newsletter. So if you'll text SC Rural Health to that number, every Monday you will receive our newsletter. And we do ask for all our partners, if they have anything, a learning opportunity or a request, whatever it may be, that they want to share on this rural focus, to let us know the week before that Monday. I think by Wednesday, by the Wednesday before that Monday, we ask for information that needs to be shared.
Any other questions, guys?
Awesome.
Well, I have
Paola
a
and
question.
Jessica. Oh, so yes, go for it.
I
Yeah.
have a question for you all. Do you have a better understanding of what the South Carolina Office of Rural Health is?
I
Everybody
personally
say
do.
yes.
I personally do, and that's even after having been, in the rural outcomes group. The program today helped kind of break it down in more concrete terms for me. So yes, I feel like I even learned a lot today.
Yeah, when we present, our goal is that you walk away with, I want to engage with them in the future, and not, this was interesting while I have my coffee and let's move on to the next thing. So we hope that's not the case, and we hope that you will reach out to us in the future.
Absolutely. I'll include information to the conference link and to the newsletter sign up as well, with the follow-up material from today's program. So
very good. Well, thank you all for your
Yes,
attention. Thank you,
you.
Daniel, for the invite.
absolutely. Paula and Jessica, thank you so much for joining us. We'll be hanging around for just a little bit longer, talking about a few more business items. Feel free to join us, but feel free to continue with your day as well. Thank you both so much.
We appreciate it, but we'll step out.
Thank you.
So much.
Sounds good. Thank you.
Bye-bye.
Bye-bye. Well, I'm very grateful for our partners and friends at the South Carolina Office of Rural Health for sharing their insight with us today, and hope that you all got as much out of that, hopefully more even than I did. I know it was a very helpful program, and think we might get a group together for that conference later this year. So we hope to see some of you there. Wanted to do a quick review of the Palmetto Vision Alliance website. Wanted to ask, if I know folks have looked at it and we've talked about it before. Is there anything that you've noticed that could be improved? Is there anything that you've noticed that we could tweak or that needs updating? What are your general thoughts on the website? Just out of curiosity, does anybody know if they've gotten any inquiries as a result of somebody visiting the website?
Nope.
All right, well, we will keep at it with that. I also wanted to talk about the idea of a statewide strategic plan for eye health. Certainly, if there was a group that was able to facilitate this, it seems like the Palmetto Vision Alliance has the stakeholders at the table to do that. We would obviously need to bring in some facilitators and some folks to assist with that. But part of our support from the Blue Cross Blue Shield of South Carolina Foundation allows us to explore some of those options for a statewide strategic plan for eye health. Is that something that y'all, at least the folks that are on this call, is that something that you would be interested in?
This is Cindy with Walton Options. I think we would be interested.
Thank you, Cindy.
This is Darling. Yes. Thank you.
Okay.
Yeah, this is Ray. It sounds like a good idea.
Awesome. Dory, I see you nodding. Yep.
I would agree.
Thank you. Abby, is that something that y'all would be interested in too?
Yeah,
Okay.
that sounds great. Yeah.
Awesome. Well, we will move forward with exploring that and starting to get an action plan together, and we'll plan on having a more detailed report for you at our next meeting, if not before then, on ways that we could make that happen. Just a brief update as well. When we met at our first quarter meeting, we talked about the release of phase 2 of the Big Data Project for South Carolina. This is the report on the prevalence of blindness and vision loss, as well as its impact on the social determinants of health and other socioeconomic factors for individuals with blindness and low vision. That report was prepared and presented through Vision Serve Alliance with support from a number of members of the Palmetto Vision Alliance, which we're very grateful for. And they are hoping to do a webinar on the South Carolina report. We're working on trying to schedule that with them. They had a number of things that they were trying to get through with the national report that they wanted to get under their belt, but look for some news from us potentially over the summer or early fall. It would probably be a standalone presentation that would be separate from our quarterly meetings, but know that we heard you loud and clear on that from our last meeting, and we're working with them to get something together for everybody on that. With that, I will open up just the general time that we have at the end of these meetings for opportunities for folks to share. What's your greatest need right now? What resources do you need? Any events or programs or things coming up that you would like to showcase or shout out to the group?
Well, here in York County, we're pretty busy over the next couple of weeks. We have a diabetes run for life, and we'll be bringing in a couple hundred runners, and all the funds go to children with type 1 diabetes. We're sending them to a week-long summer camp, and we're giving them free scholarships. So that's sort of a big deal. And we're having a children's outing the next week. We'll have 500 needy children from most of the social welfare groups in York County, sending children to a day on the lake with breakfast and dinner and fishing and boating and lots of fun activities. And we're doing the same thing in September at Camp Thunderbird. And we're hosting a holiday party for needy children.
Fantastic. A lot going on in York County, Ray. Thanks.
This is Cindy with Walton Options, and I think probably Dory could chime in on this too, but coming up, and I was just thinking about this for like quarterly, but we will be participating in like a national disability freedom and justice like caravan that'll be coming across, or actually is, I think, in process of coming across the nation. And so we'll be stopping in Georgia and South Carolina and all over the place, but both Walton Options and Able, and I think even accessibility, there's stops all over, and Centers for Independent Living are very, very much so involved in that. So as more information becomes available, I think that anyone involved in any level of working with people with disabilities, it would be highly advantageous for anyone to be able to participate in something like that.
That's wonderful, Cindy. Thank you. If you'll send that information along as the South Carolina stops become defined, we'll be glad to send that out through the newsletter.
Sounds great.
One of the things I was thinking about, Daniel, when they were presenting today is really bringing to the attention of our community that the disability community most times has more than one disability. So people are thinking that we like to categorize people in our society. It seems to be what we do. But realizing a lot of what they were saying this morning is instrumental, because a lot of people with visual disabilities, developmental disabilities like me, and other disabilities have multiple disabilities. And so the more we're getting out to the community how to provide support, or the formal word, program modifications or reasonable accommodations, I think is really instrumental. Because I think a lot of times, I think we're Centers for Independent Living, like what Cindy and I do, we work with all disabilities, but a lot of times disabilities get siloed, and people forget that most individuals have multiple disabilities. And so recognizing the supports that you need to provide for all of those disabilities is so important. I think it and hearing from the disability community is so important. I think that gets lost in a lot of the work we all do. And how can we use the Alliance to uplift that, to uplift the voices of the people it serves? I think that is just so important, because we hear back from the disability community that they feel their representation isn't being utilized. And how can we do that more? I still would like to see, I hope it's okay to bring it up here, Daniel, but I'd like to see even this Alliance bringing more of the community to the table to discuss how we can come together to support them.
Yes. No, I thank you so much, Dory. I completely agree with you. You're spot on, and that has been a shortcoming of the Alliance, not because of intentionality, just because of a lack of time to make it happen. And part of what we want to accomplish with kind of refocusing on a strategic plan is looking at how we can more intentionally integrate those voices into our work and into our operations on a regular and ongoing basis. So thank you for bringing that back up and for holding us accountable for what we say we're doing. We need that. I certainly need that. So
Can I
thank you.
offer an idea, Daniel? I've been
Yes.
pondering.
Yeah.
I wonder if we could do some kind of under the Alliance, like a focus group, kind of town hall, of kind of online, because traveling for folks gets challenging, and kind of bring people from different regions to, I'm giving you a name. I don't know what you want to call it, but like an open house focus group town hall kind of setting where we reach out to the disability community. And in this case, you're specifically addressing the needs of people with visual disabilities and welcoming them to the table, telling them first off, Daniel, what the Alliance is and what it does, how they can be instrumental in helping the Alliance to reach their goals. And then thirdly, Daniel, what are priority areas to them?
I love that,
Because
Dory.
then I think you get people to the table. I think they have to know what your mission is and what you're trying to get accomplished, and knowing how they fit into that mission and what can they do. Because when you hear it from the people who it serves and benefits, you're going to get a larger, I think, outcome. And I think that's important. And because I hear all the time from the visual disability community, but they're not here, and so I think they need to know. So even if you want some of us to have a committee to help you work on that, I think that would be great. And then how do we introduce that to the community, and things like that, I think could be pivotal to helping the Alliance move forward. Because I think we all know, because we work in the field of, disability, our ideas of what people need and want, but we need to hear from them. What do they think is the priority of what they need and want?
Yes,
And
no,
then uplifting
absolutely.
them to have that opportunity to be a part of making that happen. Because then you're truly uplifting disability representation, leadership, and empowering individuals.
Yeah. No, I think that's a wonderful idea, and I certainly would welcome all the help that I can get with putting something like that together. So let's keep that moving. Let's not let that slip through the cracks. Let's get something together for that. Darlene, I know you were coming off of mute for a minute there. Did you have something you wanted to share?
Yeah, I'm sorry, I almost forgot. I just wanted to mention that we've been busy planning several summer teen camps that we're real excited about. We're actually going to have multiple camps this year. We're working with the School for the Deaf and Blind to kind of put one together at the end of the summer. And we're hosting 2 other camps, and graciously USC has allowed us to have the camps on their campus this year because we've got a lot of major construction projects going on here. So our staff's been working really hard on that. We're very excited about those camps.
Awesome. Thank you so much. All right, well, I heard the clock chiming in the background, so that means we're at the top of the hour. Don't forget, our next meeting will be on Tuesday, August the 13th. We will have a public policy update on accessible transportation from the Berkeley, Charleston, Dorchester Council of Governments later this year on that date at our August meeting. So I know that's another topic that many of us are very interested in and want to learn more about. So mark your calendars for Tuesday, August the 13th at 9 a.m. We look forward to seeing you then. In the meantime, have a great day, have a safe summer, and thank you all for what you do.
Thank you. You too.
Thank you. Take
Bye-bye.
care, everyone.
Bye.
Thanks.